It is the #3 killer of all cancers, but it is one of the most preventable. We are talking about colorectal cancer, which does include colon cancer. Dr. Rachel Hailey from HCA Midwest Health is joining us this morning. And I tell you what, the statistics are absolutely shocking. More and more people under the age of 50 are being diagnosed. Wasn't colon cancer considered kind of a old people cancer back in the day?
Grace, you're right. The risk of colon cancer does increase with age, and it used to be considered an older person's disease. But as you mentioned, it's being diagnosed in younger and younger people, which is alarming. So it's important for people to know what lifestyle modifications they can make right now to decrease the risk, like exercise, eat healthy, no smoking. But it's also important to understand the signs and symptoms of colon cancer and when to go to the doctor, because early detection is key.
Yeah, and speaking about when to go to the doctor, I recently saw a story about a 37-year-old woman who had this abdominal pain, and she chalked it up to just some female issues. Can you refresh our viewers on what those symptoms are when it comes to this kind of cancer and when to make an appointment?
Yes, colorectal cancer is considered the silent killer because often it doesn't present with any signs or symptoms. However, some people do, like your friend, experience symptoms like a persistent change in bowel habits, like constipation, diarrhea, bloody or dark tarry stools, abdominal discomfort, fullness after eating, and unexplained weakness, weight loss, anemia. So yeah, it's understandable why women dismiss these symptoms. People just don't take them seriously because they're so vague. But I want to encourage viewers right now to check in with their gut, and if you're experiencing any of these symptoms, make an appointment with your healthcare provider and get your colons checked out.
And speaking of getting the colons checked out, how early on in life should people start doing their colonoscopies, and what does a colonoscopy really reveal to us?
Oh, that's a great question. With this increase in finding cancers in younger people, they've lowered the age to 45 for screening. Yuck, right? And as we just talked about, the most important but hardest step is making your colonoscopy appointment. The worst part is definitely the prep.
Yep. After that, you don't remember the rest.
Exactly. You're put under anesthesia, you take a little nap. When you wake up, you have your results. Oftentimes we find nothing, but sometimes we do find one or more polyps, which are small clumps of cells that are considered precancerous. And those can be easily and painlessly removed right then. But it's also important to know now we have home stool DNA testing that uses a stool sample to look for blood and polyp DNA that can indicate a cancerous condition. This can be done in the comfort and privacy of your home. So you can talk with your provider about which test is right for you based on your risk factors.
Perfect. There are options, and that's what's good.
Yes.
And of course, kind of a myth out there that colorectal cancer only impacts men.
Oh my goodness, yes, that is a myth. Most people believe colorectal cancer is a man's disease, but the most important statistic I can share with you is that approximately 26,000 women a year die from colon cancer.
Oh, wow.
So your most important risk factor is your age. Another myth is family history. Actually, only 20% or less of people who are diagnosed with cancer have a family history. On the flip side, just because your parent or grandparent doesn't have colon cancer doesn't mean you can't develop it.
Right, absolutely. And so if you are diagnosed with this type of cancer, what does the treatment look like?
Well, any cancer, when diagnosed in its early stage, is the most easily treatable. And not only is colon cancer the most preventable with early detection of precancerous polyps, but it's also one of the most easily treatable. So, cancer treatment varies on staging. You may need minimally invasive surgery, chemotherapy, and close follow-up. HCA has an amazing team that surrounds a patient through the screening process and through any cancer treatment needed. So remember, just get your gut checked out if you're experiencing any of those symptoms we talked about.
Gotta trust the gut instinct. Dr. Hailey, thank you so much for being with us today.
You're welcome.
And for more information, head on over to hcamidwest.com/colon screening. There you can find a doctor as well as risk factors.